Well, it's Thursday, and guess who's here? In Focus's health correspondent, Linord Moudou. It's good to have you back.
Good to be here.
So today you're telling us a story about literally fighting against AIDS.
That's right, physically fighting against HIV/AIDS. Former undisputed world heavyweight boxing champ Evander Holyfield is stepping back into the ring. Not to recapture past glory, but to help to raise money in Africa to fight HIV/AIDS. Holyfield will box little-known Ethiopian-born super middleweight Sami Rita in an exhibition in Addis Ababa in July. The 35-year-old Rita has won 18 professional fights and lost 3 to 46-year-old Holyfield. Is 42-10-2. He lost his last fight to Russian boxer Nikolay Valiev in December for the World Boxing Association title.
I am today because I haven't quit, and I continue to dream. I continue to strive to be the very best. But what actually got me to come here and to participate is the AIDS. I feel that it's very important that everybody do everything that's necessary to bring attention upon this cause, because if we don't find a cure to this, we'll be extinct.
From two boxers' fight against AIDS in East Africa, we turn now to medical treatment for traumatized children in West Africa. David X has the story.
U.S. Navy doctors, dentists, and construction workers visit a Catholic children's shelter in Libreville, Gabon, in West Africa. Their mission? To provide free medical care for 20 child survivors of West Africa's slave trade and to help rebuild their school. The children at Centre Arc-en-Ciel are the lucky ones. They were rescued from an underground economy of forced labor and prostitution that thrives in lawless regions and has claimed tens of thousands of West African children, according to the UN. Former slave Franck is just 10 years old. Many of his classmates were rescued by Gabonese police. Gabriela Escudero, U.S. Embassy humanitarian liaison.
Where there are children who are trafficked into the country, meaning that either for cheap manual labor, to work in people's homes, to work in factories, to work, often these kids end up on the streets if they've run away from either they've been abused or mistreated.
Captain Dennis Amundsen leads the medical team.
Our medical influence now is to go ahead and do comprehensive examinations, dental examinations, and
the sailors assigned to the Arc-en-Ciel mission are part of a new U.S. initiative to deliver assistance to West Africa. Once a year since 2007, a ship spends 6 months sailing up and down the coast, calling at around a dozen ports with teams of humanitarians and military trainers. This year, the so-called Africa Partnership Station was assigned to the Virginia-based USS Nashville.
Human capital of the country is very
Commodore Cindy Tabo commands.
But in general, the trends across the board are a lack of resources, a lack of ability to respond to incidents at sea, whether it's illegal activity or a ferry overturning. It's filled with people.
The ultimate goal, Tabo said, is to boost the ability of West African nations to handle their own security and humanitarian crises, including slavery. In the meantime, Nashville's sailors do what they can to help those who can't help themselves. For these child survivors, that means medical and dental exams.
Hopefully give them some spiritual help along the way, too. So.
For Voice of America, this is David Axe in Libreville.
And the absence. Now to Niger, where a group of villagers have decided to end a controversial cultural tradition, one that can result in medical complications. Female genital cutting, or circumcision, is common across much of West Africa. In this part of Niger, about 2/3 of the female population has undergone some form of this tradition. But now people in several villages in western Niger no longer plan to continue the controversial practice, which critics call female genital mutilation, or FGM. UNICEF and its partners helped to convince the villagers to make the change. Mamane Hamidou is a social worker in one of the villages.
Following the education we have received, sensitizing us to harm the ancestral or traditional practice, we have decided the following: to completely abandon the practice of female genital mutilation.
Female genital cutting is commonly performed without anesthesia. It is extremely painful and can be traumatizing for a young girl. It also can result in prolonged bleeding, a higher risk of HIV infection, infertility, and even death. A girl or woman who has been cut is also at greater risk of not surviving childbirth. In Kiki village, some traditional healers who have been performing genital cutting have now decided to stop the practice.
I have given up the work because it does not bring anything to our village. We thought it was good for women, that it was going to bring them success, but we found out it does not bring them anything. This is why we decided to give up.
UNICEF says in Niger, one woman dies every 2 hours from pregnancy or childbirth. The rate of female genital cutting has decreased substantially in Niger, but there are great disparities between regions and ethnic groups. UNICEF and its partners plan to repeat the campaign in 10 other villages this year. Last week, after we discussed fistula, the debilitating condition caused by prolonged labor, we heard from a viewer in Kenya, Dickens Odero Nyamugum. I followed the presentation about fistula in Africa. It indeed touched my heart, and I empathize and sympathize with the mothers experiencing this condition. Our sisters and mothers all over the world are innocent, thus must never be stigmatized. I thank you for this special coverage. And that's what we have for today.
Well, it's good that a lot of the issues you address really touch people and have that kind of impact.
Absolutely.
Well, of course, that's Linord Moudou, who joins us every Tuesday and Thursday right here on In Focus with the latest health news.
And for more information on these stories, go to voanews.com. It's time for another break. Vincent returns shortly.
And when we come back, a sign of the times, the Hummer goes green.